Hi, I am Dr. Prarampreet Singh Nagpal. I have my own hospital by the name of Nagpal Super Speciality Hospital at Bhatinda in Punjab. There is a lot of difference between the conventional and the robotic TK. The conventional, the workflow is totally reverse. You do the cuts and then you balance. And in robotics, it is totally different. You balance the knee first and then you do all the cuts. Also, there is a good pre-planning option in which you can plan anatomical position of the component, and also you do not have to dislocate the knee in the initial part. So the soft tissue releases are less. You can play a little bit with the varus and valgus of the knee as well, so that you can decrease the soft tissue releases. So it is gentle on the knee. Patients feel less pain. They have faster recovery. There is less blood loss because you don't have to open the femoral canal. So I think advantages are numerous. The patient's results are also very good. Patients are comfortable bending their knees. By second day, they are bending 120 around. So I think in the precision point of view as well as the clinical results point of view, robotics goes much over conventional surgery. The numbers are growing. Everybody nowadays wants robotics. So the number of surgeries has increased, nearly doubled within a year. The results are better, the patients are happier. And if the patients are happier, we are happier. Yeah, so the robotics enhances the precision because first, as we talked, pre-planning. Pre-planning is TT based, and so you can plan from the center of the hip till the ankle. Also, it gives you insight about the patient. Every patient, even the both limbs are very different. Sometimes there is more coxavara, there is some femoral bowing. So normally when you're doing a conventional, these all things you are not able to look at. Sometimes even some stress fractures are missed, so which are picked in the CT scan. So the precision is there. The delivery of the bone cuts is very precise.